Hi, I'm Andy Biggs, Congressman from Arizona's 5th Congressional District. I am so pleased to have with me today Dr. Simone Gold, who's not only a doctor, she's a lawyer. And so Dr. Gold is a board-certified emergency physician. She graduated from Chicago Medical School before attending Stanford University Law School to earn her Juris Doctorate degree. She completed a residency in emergency medicine at Stony Brook University Hospital in New York. Dr. Gold worked in Washington, D.C. for the Surgeon General, as well as for the chairman of the Labor and Human Resources Committee. She works as an emergency physician on the front lines, whether or not there's a pandemic. And her clinical work serves all Americans, from urban inner city to suburban and the Native American population. She does a great work. She's been a vocal advocate for both good science, good medicine, and human rights during this outbreak. And her legal work focuses on policy issues relating to law and medicine. Dr. Gold, thanks for joining me. How are you today?
Hi, good morning. I'm so happy to see you. It's great to see you.
Great to see you. And how's the lockdown going?
Oh, the lockdown, it makes me feel all warm and fuzzy inside. Like I'm really
So I want to get right into this thing about the CDC. So I mean, there's so many things to talk about the CDC. There are inconsistencies, there are reversals, they'll take a guide, they'll give a guidance, and then Dr. Redfield will say something completely opposite of the guidance. But how do you respond to CDC's assertions now, which I think it was about 4 weeks ago, when they said 94% of all COVID attributed fatalities, not just related, but attributed to COVID, fall within in a certain demographic. 94% of them are elderly, which we know they're the most vulnerable folks, and we should be protecting the most vulnerable. But they also said they have, on average, 2.6 more comorbidities. How do you deal with that as a physician?
I'm actually glad you brought that up, because I've been dealing with that for many, many months. It just hit the mainstream news, 3-4 weeks ago, but I didn't understand why it was considered news. I believe I mentioned this to several congressmen in the past, and I've been saying it in all of my speeches. Data.cdc.gov, any citizen can go and look, they can Google it, they can find it within a minute or two of the age and why people die. And I think they just started publishing it because there was so much pressure to make it public. But this has been known since the very beginning of this pandemic. When it first started in China, it affected the elderly. We weren't sure until, it escaped China. Was it going to affect a different demographic once it left their country? But it turned out, no, it was always a problem. Elderly, but more importantly, if you have comorbid conditions, always. We've never seen a lot of children get sick anywhere. There was really false news around that a few months ago, Kawasaki-like thing. It was not true. It was not accurate. It was different than Kawasaki. But it's never really been a major problem for healthy adults. Now, what do I mean by that? If you're under 60 or 65 without serious comorbid conditions, specifically obesity, diabetes, or severe underlying heart or kidney disease or lung disease, then your chances of dying from COVID are less than your chances of dying from influenza. That's very important information, because we never considered shutting down our economy and shutting down our schools and our businesses for influenza. Those are the facts. They've always been the facts. And I guess the CDC was forced to say it publicly 3 or 4 weeks ago, but that's always been the fact since the beginning. And the more people hear it, the better, because the American people need to force their government to stop these unscientific lockdowns.
Right. I mean, those are such great points. I mean, I wrote down 3 notes, 3 areas that you just brought up that I got to ask you about. So you talked about influenza, right? So we've treated COVID-19 completely different than we would treat a normal influenza outbreak, which actually is very severe in this country every year. We have thousands and thousands of people who get hospitalized. We have people who pass and expire because of influenza. But we don't ever approach it from the point of view of everything from lockdowns. But even on a more routinized basis, we don't go out there and tell everybody, wear a mask all the time, wash your hands for 30 seconds every time you touch a doorknob. The question I have for you is, and I'm hearing this, and that's being telegraphed, and I'm really concerned that as we move into an upcoming influenza season, are we going to see this kind of thing? Are we going to see policymakers try to impose these types of draconian measures when we get to the flu?
The answer, I think, is emphatically yes. It's been so obvious that the state governors and their the whole executive branch under the governors are creating policies to control the citizenry. And it's extremely dangerous from a civil libertarian's perspective. You mentioned I'm also an attorney. It's one thing to do something that has some scientific merit and still may or may not be legal or constitutional, but at least there's some point to it that people can debate it and discuss it in the state legislature or in Congress. But what we're doing is something completely unscientific with no merit. We can go over the data for hours. But we have many states that are being run solely by the executive branch. The legislative branch is not weighing in on these issues. So the issue of masks and the issue of washing hands and the issue of physical distancing 6 or 8 feet or separating by plexiglass, this has all been done by a governor saying, thou shalt do this. This has been asked and answered by our founding fathers. This is not the way we govern in America. And the people need to demand that the state legislatures take votes on these issues. They need to be held accountable for their votes. That's what must happen.
No, you're exactly right. And so we get into states, so largely, let's say a state like Arizona, where I'm from, and you come too often because I know you do a lot of great work, medical work for folks in our state. So here's the way to think of this. This really started hitting in Arizona after the legislature was out of session. And then the governor began exercising this incredibly broad emergency power. And we're still not open. He's saying we're open, but when you tell restaurants, well, you can only have 25% people and gyms 10%, whatever it may be, you're not open. You're not open to the public. So you set that aside, you say, well, what can the legislature do? They can call themselves back in, but in Arizona, it requires 2/3. And we've got one political party that says, we're not going back in because they, for whatever reason, they like the lockdowns. They like these broad powers in the governor. And the only other option is for the governor to call in, and the governors aren't going to call themselves the legislature back in to curb their power. It's outrageous. Yeah. So let's talk about something else, just real quick. And I want to talk about hydroxychloroquine. I want to talk about the use of zinc and Z-Paks in early detected cases of COVID-19. Tell me what CDC did. Tell me what so many state medical associations or their pharmaceutical boards did with regard to HCQ, and why a drug that has been proven safe and effective for 60 some odd years was suddenly forbidden effectively for you guys to prescribe.
Yeah, so this is just an example of tremendous government overreach. There has never been a situation where the governor has empowered the state medical board and the state pharmacy board to tell individual doctors which FDA drugs they could use. This has never happened. This has to shake people to their core. It interferes with the doctor-patient relationships, and it turns corporate or employee pharmacists into regulatory arms of the state, interfering with what the doctor thinks the patient should have. Let's start from the beginning. That hydroxychloroquine was FDA approved 65 years ago. It's safe in all situations: infants, babies, children, young adults, elderly, the immune compromised, pregnant women, breastfeeding women. In all situations, 65 years worth of data that it's very safe. It's never happened. The governors now went to each state and said, doctors, if you do this, you could be brought up, for example, in California, as considered to be unprofessional conduct, which is a direct threat on my license. Some states are even worse. They say that if you prescribe it in COVID, it goes against the standard of care, which is an invitation to sue that doctor for malpractice and lose. So again, no matter what you think of HCQ, you have to remember we have a system in our country for authorizing drugs. It's the FDA, it becomes FDA approved, then the decision's up to the doctor. Why is the state getting in the business of regulating what the doctor does with the patient? Doctors are already held to a very high standard of medical malpractice, lots of regulations. There doesn't need to be an additional step. And it's very, very scary stuff to have a bureaucrat tell me when I've got a patient in front of me with shortness of breath and fever and cough that I shouldn't do what I know is best. This is happening really all over the country. The data is pouring in. I mentioned some of it to you. The data has been pouring in at how effective hydroxychloroquine is. But the main point is that it's safe, and governors and their executive branch regulatory bureaucrats should not be getting in between the doctor and the patient.
So you guys, doctors have traditionally done what's off-label
Yes.
Dispensing of medicines, right? And that's what this is, right? So tell us about what that means.
Yes.
And how, is this perhaps the only case that you can name where you're forbidden from using off-label?
It's so bizarre. I have to stress that over and over. Yes, I'm so glad you brought that up. So doctors can prescribe either off-label or on-label, and it's a meaningless distinction to a doctor, but somehow the media grabbed hold of that word and then they've said it, and then patients are like, oh my gosh, it's off-label. Doctors use off-label prescriptions 21% of the time. Here's some common examples. If a 16-year-old gets into a car accident, comes into my ER with a broken leg, I would normally give them morphine for pain, right? They have a bad fracture. No, that's off-label. An older person with coronary artery disease, routinely they're on aspirin, but if they also have diabetes, that's off-label. Off-label is all the time. The reason we allow off-label usage is it encourages doctors to find new usages for medications. Women who are getting Botox injections, right? The doctors discovered that their migraines were reduced. That was like an off-label use for migraine. Botox, it's common. It's irrelevant. May I remind everybody that there are no on-label indications for COVID, none whatsoever. So yes, hydroxychloroquine is off-label. So is remdesivir. So is convalescent plasma.
Yeah. Because they've not approved anything specifically for COVID-19, right? So it just boggles the mind that why this would happen and why these I call them medical care bureaucrats would step in and impose this type of new regulation. And one thing that you said that I really love is you talked about the approach that has gone on, whether it's CDC or state medical associations or regulators. It's unscientific. That's the term you use. It's unscientific. And so I want to bring up masks for just a second, because I'm really bugged by masks about what it's doing to our society, what it's doing to little kids, what it's doing to people who have trouble breathing. You and I sit on planes a lot. I sit there on a 5-hour flight. I've got to wear a mask. The airline will boot me off if I don't wear a mask. I'm sitting next to somebody who's literally right next to me, and they're wearing a mask too. And the question ultimately comes to this. There are studies upon studies about masks. Do any of them say with any degree of certainty that a mask is going to stop the spread, keep you healthy, or are there other ramifications that occur?
Okay, so the average person should go to Google, or not Google, DuckDuckGo, let's say, and type in surgical mask and look at any scientific journal prior to 2020. There was never a pretense that a surgical mask, which is better than a bandana, for example, but a surgical mask would keep out a virus. Why? It's not made for such a thing. The pores in the fabric are about 1,000 times or 500 times bigger than the size of the virus. The virus is incredibly small. It's less than 0.1 micron. That's infinitesimally small. I've got lots of data on my website, America's Frontline Doctors, about masks. There's no question, no debate, none whatsoever. Now let's talk about the downside of wearing masks. There are plenty of downsides. The biggest one is really that it's causing tremendous social divisiveness. You have people who can't look at each other in the eye, and some people think some people are insensitive, others think some people are stupid, and you've empowered essentially regulatory arms of the state. The flight attendant has become a regulatory arm of the state. This is really a problem for society. It's a problem that people are yelling at each other and getting mad at each other. May I remind everybody that we have a former president who was a community organizer. How do you become a community organizer if you can't look people in the eye? And let's talk about the medical problems. Impetigo, it's a common childhood rash, but it's pretty bad. I don't know if you've ever seen a child with impetigo, right? So this is like begging for impetigo. I've seen many cases of this where the kids get impetigo all over them. It's super contagious. Other people can get it. They can spread it all over, and it's a staph infection. They're getting it. They're picking it up. There are so many reasons to not use the mask, and I want to say that if we're going to wear a mask, if we're going to pretend that there's a reason for it, which, by the way, we've never done with a piece of clothing in any society. Clothing has always been thought to be a religious or cultural phenomena. That's why people wear hijabs, for example, or burqas. It's a religious or cultural symbol. Why we wear hats sometimes or scarves. We need to vote. The state legislature needs to vote on this because it's an American right to wear what they want to wear. This has long been settled, common American law.
Right. And it's crazy. So I anticipate when the flu season gets here that you're going to see public health administrators mandate or attempt to mandate masks there. So let's talk about another thing with with our, yeah.
Representative Biggs, really quick, if masks worked, all right, the Asian people have been wearing masks for, I think, about 2 decades now. All right.
Yes.
I want to encourage everybody to not let go of their common sense because supposed experts are saying something else. Everything I say can be referenced. But if people are telling you something that doesn't jive with your own common sense, you really should question it, especially if it interferes with your freedom. If something interferes with your freedom, question, question, question.
Right. No, I love that. I mean, look, I grew up in a generation where the mantra was question authority. Now the people who used to say question authority have authority, and they don't want anybody to question the authority. So that's really odd. But let's talk about some more of our favorite healthcare bureaucrats. I want to talk about Dr. Fauci for a second. Now, Dr. Fauci recently said, probably about a month ago, said that he thought that Chris Cuomo and the way New York handled the COVID-19 outbreak in New York City was the model for the world. And I find that astounding because my theory is this. They missed it. They thought there would be a surge. There was a surge. It was of elderly people with comorbidities who needed hospitalization and needed care. They rejected that care through effectively a death panel saying, you go back to the nursing homes. We're going to keep the hospitals open for other people who are going to come in. That is a death panel, number one. And number two, that's a lousy way to treat a public health outbreak of an epidemic, in my opinion. What do you think of the way Governor Cuomo handled New York? What do you think of that? Of Cuomo?
You know, it's funny. You probably don't know this. I tweeted sometime last week that the 5 worst governors handling this crisis in their states, and really number 1 or 2 was Cuomo. I listed the 5. It was Cuomo, it was New Jersey, it was Wolf in Pennsylvania. The reason is they did not protect their vulnerable. Let's remember, we knew since the very beginning, December, January, that this was bad for elderly. And I was watching the coronavirus task force meetings every day that I wasn't working clinically. Day after day, Governor Cuomo said, we have to protect the elderly. We have to protect the elderly. We have to protect the elderly. Then what does he do? He then, personally he issues an executive order allowing hospitalized patients with COVID to go back to their skilled nursing facilities. And the nursing home was not allowed to ask the COVID status. It was actually against the rules. They were barred from asking that. That meant that patients discharged from the hospital went back to the nursing home with or without COVID, were intermingled with the rest of the nursing home patients, and so many patients died. The hospital ship was empty. Jacob Javits was empty. There was plenty of places you could have put these patients. And I just want to say, as an ER doctor, when I used to see a nursing home patient come in, I used to cringe because I knew there were 5 or 10 behind that one and they would do very badly. He was one of the worst, if not the worst. New York, New Jersey, Pennsylvania, and a couple of others were terrible. They killed those patients. Yeah,
no, I agree with you 100%. And I believe the political environment is such that right now, the people like you and I, we get canceled and people want to cancel us for speaking out on this. In the end, though, when we look back 5 years from now, people are going to say, these guys were right. Cuomo was terrible. They killed these people. And so you have an organization. I'm getting, believe it or not, we're getting short of time already, but I want to get to this. You have a wonderful organization called AmericasFrontlineDoctors.com. Is that where we go? AmericasFrontlineDoctors.com?
Yes, sir. Yes.
Okay. And I will just say to anybody that's listening to you and I today, that you can go there and there's a wealth of information you can see. And it's not Dr. Gold's opinion. It's not my opinion. This is all scientific based. And I just want to, before I get to you, and I want your response on this, Dr. Redfield, the head of the CDC, was heard ranting about Dr. Scott Atlas on the plane. And so Dr. Atlas was asked, how do you respond to that? And Dr. Atlas said, I responded this way. I follow the science, I follow the data, and that's all I do. And then he started giving citations and references of doctors and prominent epidemiologists who he relies on that are out there. They're given the true information, and yet the CDC director himself has said that masks will be probably more valuable at stopping the spread than a vaccine. So you just go, well, I'm shaking my head. But tell me about your organization. Tell us all about your organization.
Thank you. So AmericasFrontlineDoctors.com. We are frontline doctors that see patients, and we have no incentive other than to bring truth to the American people. So it's a pretty simple website. You can watch educational videos. You can look up some reference articles. They're non-opinion. There's the scientific articles that that we've pulled out for you. There's a lot on masks and there's a lot on hydroxychloroquine. The other thing that we do is we make it available to all Americans the possibility of consulting with a hydroxychloroquine knowledgeable doctor and hydroxychloroquine knowledgeable pharmacists who are not interested in interfering with the doctor-patient relationship. This is critical because a lot of states, yours included, Arizona included, have made it almost impossible for patients to get hydroxychloroquine. I firmly believe that really everyone should have hydroxychloroquine in their medicine cabinet. This is not going away anytime soon. The virus is manageable for sure, but the politics of it are not going away, and you need to empower yourself. And I'm sorry to say this as an American, I just don't think you can really listen and trust to people that are calling themselves experts. I don't ask you to listen to me. I point you to the articles and the sources that you can then choose to decide on your own if they've got merit and weight. But if you want to help yourself, americasfrontlinedoctors.com, go find yourself a telemedicine doctor, get the hydroxychloroquine, put it in your cabinet. You'll have it if you need it.
Well, Dr. Gold, I always love talking to you. First of all, you're bright, you're energetic, you're articulate, you're passionate, and you're scientific. You're always referring to, and that's the way I feel about it. So when people chastise me, I say, "Oh, you don't have to believe what I say. I can give you data and information that I've accumulated, and if you decide I'm wrong after looking at all that scientific information data, then that's fine. I'm okay with that. That's your choice. But at least let's educate ourselves as Americans. That's part of being free is taking the responsibility of educating yourself and defending your own self and your own rights. And so you do a tremendous advocate for that, and I'm so grateful. Thanks for taking a few minutes with us today, Dr. Gold.
Thank you so much. Thank you for having me.